We came to the issue of participatory changemaking through our experience of working in India back in 2004. By bringing in different communities and different stakeholders into the process of policymaking, you actually do get a different outcome in terms of systems which often are only geared towards, for example, corporations or particular interests. Having these different voices in the policy-making space are a catalyst for a new conversation and also a catalyst for different types of policies that we're now starting to see. Through participatory change-making, we're trying to actually build a bigger table.
Patients deserve to have their needs prioritized and at the very least considered.
Lawyers have a certain understanding of the patent system and how they think that should work. Innovators or people who seek patents have their own perspective. Patients who are benefiting from innovation. And we have to be able to bring all of those perspectives to light and to understand how they can work in harmony to come out with the best decisions possible.
I've been following and working with I-MAK for a good amount of time here. And one thing that I've always found alignment on is its focus on people who are most disadvantaged by the systems and structures in place.
Well, as we're seeing today, pharmaceutical companies, particular private interests, are essentially the main clients of the patent system. The public, which is what the patent system is supposed to serve, are involved in it very little.
We are able as patients and patient advocates to speak to legislators about policies, but when it comes to patents, we don't have much say in that regard.
I think this kind of collaborative discussion among academics, policymakers, and public interest organizations is really valuable because we do have different perspectives.
And what we're seeing is that policymakers have now become more aware of some of the issues that are happening within the patent system, whether it be through I-MAK's research or whether it be through an advocate who's saying that the patents around a particular insulin product are causing the prices to go up.
One of the points in this convening that I found really, really useful was speaking to a patient who told me about a mechanism by which patent thickets have created a monopoly in this person's particular circumstance. And I had no idea that the patent on that drug creates an effective monopoly for a large range of patients with her condition.
Since we started this process 2 years ago, we've had the Patent Office take some of our suggestions and actually implement them. We've had the first public interest person appointed to the Patent Public Advisory Committee. These are big shifts that weren't happening before. And I believe we've got more coming down the line because this conversation is only swelling even more.
It's incredibly important for us to have some sort of say in this.
We're the ones that who need these medications to save our lives, so it's important that we have a seat at the table.
So then as you're doing things like creating patent law and creating patent policy, you have those voices in place.
That's the only way that change happens, when people with different perspectives can exchange information and compromise to achieve some sort of shared pathway to a solution.